Zach Barth, Officer Crystal Greiner, and Officer David Bailey. As Gabby Giffords noted yesterday, recovery from an attack like this requires great courage, and we know that each of these individuals I've named have courage in great supply. Capitol Police and Secret Service and the individual police officers who stand at our town meetings, our community gatherings, they are always ready and willing to give their lives, not to protect an individual, but to protect our unique, extraordinary American system those individuals serve. We will strive to be worthy of these brave men and women and the ideal that they protect. And we're going to stand united against act of violence, any act of violence that seeks to tear our system down. Now to the topic of opioids. We want to start by noting that the opioid epidemic has hit communities from Portland, Oregon to Portland, Maine like a wrecking ball. On the front lines of that fight is Medicaid, the largest single payer for substance abuse treatment services in our country. The House-passed bill would end the only lifeline for many who are trying to put their lives back together, and it does it by cutting $834 billion out of the Medicaid program. Now we are hearing that instead of correcting this devastating blow to working families, seniors, and others who rely on Medicaid for basic health needs, Senate Republicans may create a separate pool of money to pay for opioid addiction treatment. I will tell you, the idea of creating an opioid silo isn't going to work, and don't take it from me. Treatment experts like those from the National Council on Behavioral Health and from the AIDS Institute have been sending a clear message. This idea of creating this kind of silo is going to fall short for the people who need it most. And that's because the services to really meet the needs of these individuals, as Senator Markey and Senator Hassan know, it's critically that they be integrated, and particularly for younger and older people. This is so important. So the approach doesn't do right by those who need help, and it's about political expediency to get 51 votes here in the Senate. We believe treating a substance abuse disorder ought to be the same as treating other diseases. The country doesn't pay for heart surgery through a grant program. The country doesn't pay for chemotherapy through congressional appropriations. When you're sick and you have health coverage, you can get what you need. Second, you don't fight a public health crisis with grant funding alone. You don't pay for life-saving treatments and long-term addiction recovery exclusively through grants. In effect, cutting off Medicaid this way is like tying one hand behind your back at a time when you need all the hands on deck. And trying to make up hundreds of billions of dollars in cuts to Medicaid with a bit of funding outside of integrated health programs is like putting a Band-Aid on a mortal wound. It doesn't work. It's dangerous to think it will. And that is the consensus view that we're picking up from independent experts. It's also important to keep in mind that someone dealing with opioid addiction often needs treatment for other health conditions. It can be diabetes, a mental health issue, a whole host of other matters that an opioid treatment program isn't going to help with. So we need a full array of coordinated services to really meet the needs of patients, and an opioid silo is not going to get you there. One last point about flexibility. Under a proposal that is now apparently being widely discussed, the federal government would have the power to tell states what kind of treatment facilities or medication-assisted treatments grant funding could go towards. Instead of letting states pay for the care they know works best for their states. That doesn't sound to me like the kind of flexibility Republicans have used to justify their massive cuts to Medicaid. When the Affordable Care Act expanded Medicaid, hundreds of thousands of Americans suffering from opioid addiction finally could get an affordable source of care to recover from substance abuse. The Republican plan repeals the Affordable Care Act, undoes the progress, and it's our view that it will effectively end a chance at recovery for millions of Americans who are suffering from substance abuse disorders. We are going to be working together to stop the deadly consequences of opioid addiction and provide treatment for those who are suffering before it's too late. But it's just malpractice for senators to just sit idly by and watch a bill that throws millions of off Medicaid with an expectation that a few extra dollars will make up the difference. We're not going to do it because we are not going to let Americans suffer this way. And by the way, last point, since I'm on the Finance Committee, the cuts in opioid treatment aren't even going to other parts of the healthcare system. They are going to fund tax breaks for the fortunate few in America. That isn't brave. That's not fiscally smart. It's just plain cruel. So my colleagues, we're all going to have some short remarks. We'll just go in terms of seniority. Senator Blumenthal, we're glad that you're here. And as you know, we have votes in a little bit, so we're all going to get our comments in. The second one? The first one?
First.
Yeah.
Have you voted?
Yes. Yeah,
okay. Have you voted, Matt?
Yeah.
Okay. I really want to thank Senator Wyden for bringing us together to talk about an issue that plainly and desperately confirms every one of our states. We've seen a 25% increase from the year before in the levels of overdose deaths all around the country, and if anything, even higher in Connecticut. All of us have stories about tragedies. There's no state that has been immune, no community that has not seen these deaths and tragedies. So the Republicans say, in effect, trust us. We have a secret bill. We have alternative funds. Trust us to do the right thing, even though we're doing it in secret, and we don't know what we're doing. And that's no way to address a national crisis, an epidemic that is truly a public health crisis. And there is strong bipartisan support for effective action here, and the Republicans simply need to have the will to address this problem without gutting Medicaid. That's the key. Do not gut Medicaid. There's no way that these alternative funds could ever adequately replace comprehensive insurance coverage or the progress that we've made in substance abuse treatment under Medicaid expansion. That is the simple truth. These alternative funds are completely inadequate to replace the gutting of Medicaid and other essential coverage. And the American people should know, because they are so deeply concerned, we hear it every day in our communities, they know there is a public health crisis, and they know that this epidemic has to be addressed more effectively than we can see it right now. Thank you, and with that, I want to turn to our colleague, Senator Markey.
Thank you, Senator Blumenthal. I just want to echo what Senator Wyden said about this attack upon the Congress, upon the Capitol Hill officers, and upon the staff. It's an actual attack upon democracy, and we all stand united, Democrat, Republican. There is no division amongst us. We have to keep this Capitol open and free for access, while at the same time providing adequate security so that incidents like this don't happen. But when one does, we stand united to ensure that we provide the comfort for those who have been harmed, but also the guarantee to those in the future that we will provide the additional security which is necessary. Everyone here knows what an epidemic looks like. In America last year, 33,000 people died from opioid overdoses. In Massachusetts, 2,000 people died from opioid overdoses. If people were dying across America at the same rate that they're dying in Massachusetts, 100,000 people would have died last year, but only 33,000 died across the country. That's a preview, however, of coming attractions, what's happening in Massachusetts. 1,700 people died from fentanyl in their blood system. If they were dying at the same rate across the whole country, that would be 70,000 people dying from fentanyl. This is an epidemic of unbelievable proportions. It's historic in nature. We tried to put together a bipartisan coalition last year. We did so successfully. The CARA bill was something which was successful. The 21st Century Cures bill, that was successful. But all of this bipartisan progress combating the opioid epidemic will be thrown out the window if Senate Republicans move forward with their plans to repeal and replace the Affordable Care Act. We know that the Senate Republicans are not going to completely rewrite the House-passed legislation, which will rip coverage away from 23 million Americans and gut Medicaid by more than $800 billion. The bill that they come up with will only make modest tweaks to that terrible legislation. In fact, any Republican health care proposal will be a wolf in sheep's clothing that only makes the opioid crisis worse in our country. By ending Medicaid as we know it and gutting consumer protections in the private insurance market, Trumpcare will shift billions of dollars in costs from substance abuse service and put that burden on the states and on families who cannot afford it. Experts say Trumpcare could cut upwards of $7 billion per year from behavioral health care by 2020, blocking people from accessing treatment and transitioning to recovery. This would be a death sentence to the 2.8 million Americans with a substance use disorder, including over 220,000 with an opioid use disorder who are at risk of losing their insurance if the Affordable Care Act is repealed. For individuals suffering from substance use disorders, repealing the Affordable Care Act isn't about repealing a health care law. It's about repealing hope. Hope that treatment is near and recovery is possible. And all to give billions in tax breaks to the wealthiest in our country. That is cruel, that is inhumane, that is immoral, to take the funding for programs for those who are sick and need help and then take that money and give it to the richest in our society is just plain wrong. Among the hardest hit by repeal would be those patients that access treatment and recovery services through Medicaid, which pays for nearly half of medication-assisted treatment provided in Massachusetts. In fact, Medicaid is the largest payer of substance use disorders in the country, and many of the states most devastated by the surge in overdoses, like Massachusetts, have relied upon Medicaid to connect residents to care. It would be shameful to take the coverage for medication-assisted treatment, which is half of all people in our state who get that coverage, take that money and hand it over to the other half of the people in our state as in the form of a tax break who can afford to get treatment with medication-assisted treatment. That would be wrong. That would be immoral. That's what their plan is. And no matter what the Republicans try, there's no treatment to make Trumpcare better. And if this bill becomes law, there is no Narcan for Medicaid. Once it's cut by Trumpcare, it is dead. We're hearing that Senate Republicans could create an opioid fund as a meager attempt to appease those who have called out the cruelties in this bill. That extra funding would be crumbs. It would be trading land for a couple of beads. That is what their proposal is going to be in reality. It will just be a sop to the discontented from their perspective. Republican health care legislation will rob access to coverage, treatment, and prevention for generations to come. But this betrayal of progress on the opioid crisis doesn't just end with the repeal of the Affordable Care Act. You have to see this in the total context of what they're doing. President Trump has proposed slashing the National Institutes of Health research budget by 18%, which will slash the ability to do the research to better understand addiction treatments that do not use opioids. The president is proposing to cut the State Department's international narcotics cooperation budget by 32%. That's the funding that helps stop the flow of deadly illicit fentanyl before it ever comes from Mexico or China into our country. And he wants to cut the CDC budget by 17%, undermining our ability to monitor the crisis so that states can deploy solutions. We are hemorrhaging lives every day, and Trumpcare will do nothing to staunch the flow of suffering and death from this opioid crisis. We cannot be fooled by this historically damaging legislation. This is the battle of the generation. I've been in Congress for 41 years. The most important vote that I've ever cast is for the Affordable Care Act. The second most important vote that I will ever cast is to block the repeal of the Affordable Care Act that the Trump administration is attempting to accomplish in this Congress. With that, let me recognize the great senator from the state of New Hampshire, Maggie Hassan.
Thank you. Thank you to Senator Markey and my colleagues, Senators Wyden and Blumenthal, also here today. I join with them and with all of our colleagues in wishing a quick, speedy recovery to those injured yesterday, and am deeply grateful for everything that our Capitol Police, our law enforcement, does to keep us safe, but most importantly, as Senator Wyden said so well, to protect the ideal that is our democracy. I want to start my comments this morning by talking about the secrecy around the Senate version of Trumpcare, which really shows that Senate Republicans know just how deeply unpopular their bill is. I come from New Hampshire, where we have a large citizen legislature, 424 people. But here's the thing, even with 424 legislators, all of whom may draft bills, every single bill in New Hampshire gets a hearing. You can't pass a law in the state of New Hampshire if the bill didn't get a hearing. So I urge my colleagues to hold public hearings on this bill so that we can examine it for ourselves and get feedback from our constituents. From what we've seen in the House Trumpcare bill, this legislation would hurt hardworking people across New Hampshire and across America. And in particular, it would hurt our efforts to combat the heroin, fentanyl, and opioid crisis. As governor, I worked to pass and reauthorize New Hampshire's bipartisan Medicaid expansion plan, which is providing coverage now to over 50,000 granted staters, including coverage for mental health and substance use disorder services. And I've told this story before, and it bears repeating because it's a great example of how important Medicaid expansion is to those struggling with substance use disorders. A woman named Ashley from Dover, New Hampshire, lost her husband in December of 2015 to an opioid overdose. She, too, had addiction. So she pursued coverage through Medicaid expansion and got treated for her addiction. Now, about 18 months later, she continues to be in recovery. She is employed, and she's now getting her health insurance through her employer, so she's on the private insurance market. That's exactly the kind of difference that treatment that is authorized and paid for by Medicaid expansion makes in the lives of real people. Well, Trumpcare would end Medicaid expansion, which experts have said is the #1 tool we have to combat the crisis, because experts in the field, those providing the treatment, need to know that there will be reimbursement there so that they can expand their services, see more patients, save more lives. Additionally, this plan also changes Medicaid into what they call per capita caps system, which is just code for massive cuts. Those cuts would force states to choose between slashing benefits, reducing the number of people who can get care, or both. Under Trumpcare, states will be faced with cutting services that people who experience disabilities, people in nursing homes, and children depend on. There's now talk of Republicans adding a pot of opioid grant funding to try to distract from the devastating impact that slashing Medicaid would have on efforts to combat this crisis. Adding opioid grant funding wouldn't come close to making up for the damage that the massive cuts to Medicaid would have. More funding to combat this crisis is something we need to do in addition to Medicaid funding, not at the expense of it. And Trumpcare undermines the requirement that insurance companies must cover mental health and substance use disorder services. In the midst of this crisis, we should be strengthening prevention, treatment, and recovery services and efforts, not cutting them. And cuts to programs that help people in the throes of addiction are irresponsible, to use Senator Markey's words, immoral, and just plain unacceptable. I'll continue working with my colleagues to defeat this dangerous bill that would truly pull us backward. I urge people in New Hampshire and across America to continue making your voices heard. All across our country, brave people who suffer from addiction have stood up, told their stories, worked to get treatment, and stayed in recovery, and are working every day to make sure that we recognize addiction for the chronic illness that it is. We need to continue to work together. We need to provide more resources to combat this epidemic, and I encourage all people across our country to call their senators and speak out. Thank you.
All right, we've got votes coming up on the floor again, but let's throw it open for a couple questions. Yeah.
I want to start, Senator Hassan, you mentioned this. The secrecy with which Republicans are writing this bill, you don't know what's in there right now to fight the opioid crisis or not. Is that right?
I'll just offer you what happened in the Finance Committee and then turn it over to Senator Hassan. We were discussing this yesterday, and there was discussion about there was a partisan divide with respect to this issue. And I said, you don't have a partisan divide when you're talking about being able to read a piece of legislation. That's something that is so basic, so fundamental to representative government, it should be something that we always have traditionally taken for granted. So we talked about this yesterday in the Finance Committee, but since Senator Hassan made the point very eloquently, let me turn it over to her.
Well, thank you for the question. And what this means is that because we don't have an actual draft bill, or we haven't been even part of the hearings, in our Health Committee hearing this week, the Democrats all made the point that while the hearing we were having was important, it was about prescription drug prices, it was kind of irrelevant because if people don't have coverage to begin with, the whole discussion about how to adjust insurance coverage for prescriptions didn't make sense. So we asked to have a hearing on the health care bill, something that the Republicans have said they're not going to do. And so the information we have about this new fund that's supposed to distract people from the fact that the Trumpcare plan cuts Medicaid expansion and cuts Medicaid significantly, and so does President Trump's budget, right? So Trumpcare cuts Medicaid by $800 billion plus. The budget cuts another $600 billion plus. So we're talking over $1.4 trillion in cuts to Medicaid. And what we know is what we kind of read in the press about what some of our Republican colleagues are telling all of you. But that's what we're really reacting to. Sorry?
You're learning about the contents of this bill from reading the news.
Right. And, as I noted, and I'm sure it's true in most states, in New Hampshire, we have a hearing for every bill, and people show up and they sign in and they get to speak to the bill. And one of the ways we learn about good policy is from our constituents who come forward and talk to us about their lives and react to the language they see before them, and we make changes and we improve and we come together and we get things done. That's what we should be doing here.
There's a real danger here that this kind of legislating is going to become the new normal. I was watching this morning on MSNBC, Morning Joe, Senator Thune was talking about health care, and he was asked about the bill, a question about the health care bill, and he said, well, we don't have a bill yet. Like, perfectly normal, we don't have a bill. And yet, we're going to potentially have votes on it next week. And we're supposed to be considering the merits of a bill that has not been, to quote him, I think almost exactly, reduced to writing. And I thought to myself, is this the way we're going to legislate from now on? Where, you know, a tax reform bill is a single piece of paper with a bunch of bullet points, or a health care bill is a bunch of points made in public in the public realm, but not with any specificity or definiteness. And I think there really is an important principle here about democracy and about people knowing that gutting Medicaid is going to destroy opioid abuse and addiction treatment in the United States of America. Call it immoral, irresponsible, it's all of it, but Americans want addiction and opioid abuse to be recognized as an illness. It's not a moral failing, it's an illness. And this idea perpetuates the stigma, in my view, and the shame that a lot of people feel and embarrassment that they will not come forward.
The Finance Committee is the committee of jurisdiction to pay for American health care. Hundreds of billions of dollars. I have never seen a circumstance like this. This is without precedent that a committee that has the legal obligation to oversee the expenditure of billions and billions of dollars is completely in the dark. And we said that yesterday. We're going to keep saying it. Why don't you ask a question? We'll give it to Senator Markey.
Great. How do you plan to dramatize to the American public that 20 million people might be about to lose their health care? I see that there's a press conference here. I know that there are more planned, but it seems like business as usual. It seems like that sense of outreach is not being channeled to the public right now, and that's making it easier for some Republicans to move forward.
Think of every Trump tweet as an attempt to get the media to not cover the destruction of the Affordable Care Act. That's what's going on.
Democrats going to do differently?
And that's what I'm saying to you. Okay? So that's their plan. So what we're beginning is an effort to say to the media, don't allow the tweets to distract you from the actual Trump agenda, which is to gut Medicaid, take $800 billion, and then hand it over in tax breaks to the wealthiest people in our country. So our job will be to say to the poor, the sick, the elderly, the disabled in our country, and those who care about them, that there is a secret plan that the Republicans have to have no hearings on their bill, to have no amendments be made possible to their bill, and to have a single vote on that bill that will have a fundamentally harmful impact on 20 to 30 to more millions of people in our country. And we believe that the moral imperative of this issue will be able to supersede the media's obsession with every Trump tweet, because this is the issue of our time, the impact on the poorest and the transfer of that revenue to the wealthiest. And if the media doesn't understand that, then they're missing the biggest political story of our generation. And we just hope that today's press conference and other things that we're going to do will redirect the attention of those who write the front page stories, the editorials, towards the big story. Because so far, they've been missing the biggest story of 2017, the repeal of the Affordable Care Act, the destruction of access to health care for 23 million people.
What I can tell you is I believe you're going to see a grassroots juggernaut from one part of the country to another getting involved here, recognizing that the next 2 weeks are pivotal. We believe this is go time. We've been meeting with organizations of healthcare providers from all over the country with thousands and thousands of providers and patients they see. They're going to be speaking out. We're all holding community meetings. I mean, I'm on the Intelligence Committee. When people ask me a question about Russia, I say, I'm happy to talk to you about it, but you're going to have to listen to me talk about the healthcare challenge ahead. So we are all in. The four of us, our entire caucus, led by Senator Schumer, we are going to have a steady diet of activities to indicate we are pushing back. And they really started last weekend. I had 4 town hall meetings at home in Oregon, and every one of them focused on health care. Why don't we take one last question?
Thank you. When it comes to opioids, is there any proactive attempts being done in the Senate right now to curb like the aggressive like opioid marketing and lax prescriptions?
One of the things that we did in our confirmation hearings with Dr. Gottlieb, the new FDA commissioner, was make this an issue. And the FDA, you may have read, has been taking some actions around the issue of the way these medications are being prescribed or marketed. We know that this is a complex issue that was this epidemic was a long time in coming. It involves marketing by big pharma. It involves prescribing practices by doctors. It involves the development of an evolving and very, very clever cartel. And it's an all hands on deck fight. But the HELP Committee is focusing on the way these opioids have been marketed, and I am encouraged by the new FDA commissioner's attention to the issue.
We'll finish
You know,
with Senator Blumenthal.
there is so much more that needs to be done in this area. When I was Attorney General, I sued Purdue Pharma because of its deceptive marketing of OxyContin. Purdue Pharma has come a long way, but the excessive marketing and overuse of opioids is scandalous. And it is also deeply wrong that federal regulators have permitted it to continue. And I think there needs to be a much more strenuous effort to stop the overuse and overprescription and overmarketing of powerful painkillers. And by the way, what we're seeing in Connecticut now is counterfeit oxycodone with fentanyl and new opioids, carfentanil, which is the elephant tranquilizer as it's come to be known, because it is used on animals like elephants. It's 10,000 times more powerful than morphine. The mixing of these drugs with so-called legitimate painkillers is one of the great threats right now.
And I actually have some legislation I'll be happy to share it with you too.
Thanks, everybody.
Thank you.
Thank you, Senator.
Thank you.